Hello everyone, I am Dr. Chinnababu Sunkavalli. I will be talking about the misconceptions about cancer. Many myths are around today for cancer, and as a cancer surgeon, day in day out, I face these misconceptions, and people have a lot of taboos associated with cancer. So let us discuss a few misconceptions today. Number one, cancer is not curable. Many people think that cancer is not curable. This is often thought by people, and this is a myth, and cancer is curable, especially if it's diagnosed very early. So the cure of the cancer depends upon the type, the site, and the stage. So some cancers, for example, thyroid cancers, where the results are extremely good, more than 90% overall thyroid cancers, we have the survival rates or the cure rate. So the outcomes depends upon the stage and the site, but the cancer is curable. So if we detect it early, it is curable. Secondly, the second misconception that I want to highlight today is cancer is contagious. Many people think that if they are with a cancer patient, they can get the disease. So cancer is not contagious. However, some infections which can lead to cancer, for example, HPV infection, or for example some bacterial other infections also can lead to cancer. They can cause cancer, but the other third misconception is biopsy aggravates cancer. Many people think that if you do a biopsy, you are actually spreading the disease to other parts. That's why biopsy should not be done. No, this is a misconception, and biopsy is a medical procedure which is very useful to diagnose the disease and to identify the type of the disease, and it is mandatory. But there are some areas in the body where biopsy is not done. For example, gallbladder cancer, or a pancreatic cancer, or kidney cancer, or for example in the early stage of ovarian cancer, where we are worried about the spillage, or sometimes we are worried about the bleeding. That's why in these areas we do not do. For example, liver cancer, sometimes we do not do biopsy. So, but in general, biopsy does not aggravate the cancer or lead to the spread of the disease. Similarly, a family member having cancer means 100% chance of other members getting cancer is a misconception. If the risk of familial cancers is about 5 to 10%, and most of the times the cancer is sporadic. It comes in the isolated instances. So please do not worry if some member in your family is affected with cancer. Do not worry about you getting. The risk is much less. So a misconception that once somebody is diagnosed, other people will also get. That is a wrong notion people do carry. Cancer surgeries are often mutilating. They are very painful, and they're also debilitating. This is a misconception. Good old days, yes, cancer surgery was very radical. We used to remove the entire organ, we used to remove the surrounding lymph nodes, we used to do a more radical surgery so that the cancer is removed en bloc and outcomes are good. But today, thanks to the advent of precision oncology, we are looking at organ preservation surgeries. For example, breast cancer. Just 2 decades ago, we were removing the entire breast was removed for any stage of breast cancer. Today, we are looking at breast conserving surgery, even in locally advanced breast cancers. Similarly, we are looking at organ preservation for larynx cancers. We are looking at organ preservation for bone cancers, where amputation used to be done. So, in that sense, the precision oncology is helping us to not only give the best outcomes in terms of the survival rates, but also better quality of life. So the preservation of the quality of life is very important. For example, for those with colorectal cancers, the rectal cancers, especially those involved, very low down the rectal cancers. Good old days, we used to remove the entire sphincter and to have a permanent colostomy. But today we have organ preservation strategies wherein the sphincter preservation is possible, and with the help of robotic surgeries, with the help of the newer technologies, we are able to preserve more sphincters and give a better quality of life instead of removing these organs. So the advancement in terms of technology and the drug discovery is really helping us to give a better outcome. So do not be worried about the effects of the mutilating effects of the surgery. And today's surgery is much more simpler, much more patient friendly, and the outcomes are much better. Thank you so much for watching this video.